Good afternoon, ladies and gentlemen. The webinar is starting now. Let me remind you first, all the speeches will be and messages will be conducted in English. And may we remind you all to turn on your cell phones and switch them or switch them to silent mode. Also, please make your microphone muted unless you are speaking. So, distinguished guests, ladies and gentlemen, good morning and good afternoon. Welcome to join us at 2020 Dubai FDI and TAITRA webinar on healthcare sector investments opportunities in Dubai. My name is Tuqa. I'm your MC for today's event. So this webinar is jointly organized by Dubai FDI and TAITRA. Today, we have an incredible lineup of experts from Dubai FDI, Dubai Health Authority, Dubai Healthcare City Authority, and Dubai Science Park. Moreover, we're very happy to have 5 medical speakers from Taiwan, including Ida Hospital, EPED Inc., Cloudmed, Soteria Biotech, and LIGHTMED Dental. They will be sharing to you the best medical solutions in Taiwan and their experiences of Middle East medical industry. Before the keynote speech, I would like to invite Mr. Walid Abdullah to speak on behalf of the CEO of Investment Promotion Department in Dubai FDI, Mr. Fahad Gergawi, to give us an opening remarks. Let's now welcome Mr. Walid Abdullah.
Thank you, Tuqa. Good morning, everyone, and good afternoon to all the participants in Taiwan. It's given me a great pleasure to be part of this webinar today. Ladies and gentlemen, it's a pleasure to welcome you all today for discussion on the opportunities in Dubai healthcare sector and how business and investors worldwide, and particularly from Taiwan, can join hands in this growth story. Dubai FDI is grateful to the Taiwan Trade Center TAITRA for jointly hosting this webinar. We have with us representative from Dubai Health Authority, Dr. Ibtesam AlBastaki, and Dubai Science Park, His Excellency Marwan Al-Janahi. Together, we aim to provide a comprehensive overview of the Dubai advantage and the city of inviting investment on the healthcare sector. The healthcare sector, which has always been a focus area of the government of Dubai, has been at the forefront of our fight against the coronavirus COVID-19. A robust and responsive healthcare system has been helped Dubai to minimize the effect of the pandemic and ensure the city return to business opportunity in this challenging period. Ladies and gentlemen, our two countries of Taiwan and the UAE, we have joined a steady trade partnership through decades. The trade between the two countries reached 22 billion UAE dirham, which is 172 billion new Taiwanese dollar in 2019, an increase of more than 4% over the previous years. As long as time of the FDI partner, Taiwanese investment have been steadily growing in sectors such as wholesale and retail, financial service and insurance, and hospitality. In addition, Taiwan emerged among the top suppliers of personal protection equipment to Dubai in 2019, supplying protective from medical staff with 44% market share. Last year also saw Taipei-based fintech company Alltel blockchain service, which targets solution in logistic healthcare, hospitality, aviation, agriculture, and manufacturing, among other sectors, enter into a strategic partnership to drive blockchain adoption in the UAE. As a home to expats and business from all over the world, the UAE is considered a very diverse, stable, and secure country. Strengths such as a global connectivity and ease of doing business with an effective digital transformation strategy have enabled Dubai to position itself as a city of the future and a gateway to the region and hub in the global economy. As Dubai strides toward becoming a connected smart city, healthcare services delivery a crucial part of its digital readiness and innovation across services, supply chain, and industry. Announced in 2017, the Dubai Health Strategy 2021 aimed to develop a comprehensive and integrated health service system that encourage early detection and regular checkups. Mandatory health insurance cover close to 100% of Dubai population. Healthcare expenses reached 17.5 billion dirham in 2017, with private insurance accounting for 60% of this. Taiwanese companies in various sectors, including healthcare technology, and poised to play an important role in the sector. Dubai healthcare sector present high level of opportunity for serious investor. At Dubai FDI, the team is remained to focus on helping you to make a successful investment on the city. I would like to conclude this speech today by thanking everyone to be part of this webinar, as well thanking our stakeholder for their continuous support, Dr. Ibtesam and His Excellency Marwan Al-Janahi, and TAITRA for organizing this webinar today. Ladies and gentlemen, we'll be at your disposal to answering any of your questions at the end of this webinar. Thank you for your time and attention. Thank you very much.
Thank you, Mr. Walid Abdullah. And next, we'd like to invite Director General of the Commercial Office of Taipei, Mr. Gergawi, to share a few words with us. Let's now welcome Mr. Yang.
Thank you. Director Wang of Taiwan Trade Center in Dubai, Mr. Walid of Dubai FDI, distinguished speakers and participants, good morning. On behalf of the Commercial Office of Taipei, Taiwan in Dubai, it's my pleasure and honor to participate in today's webinar for the exchanges of medical expertise and experiences and the promotion of investment opportunities in healthcare sector. I would particularly like to say thank you to Mr. Wang for making this webinar possible. As we are well aware that the COVID-19 is still an ongoing global pandemic, and Taiwan, as a member of the international community, is willing to share its expertise and experiences and make efforts with the rest of the world. We are also keen to learn the valuable experiences and expertise from the world to ensure that we can not only find a better solution to fight against the COVID-19, but also to create beneficial investment opportunities between UAE and Taiwan in healthcare center in the near future. My best wishes for the success of the meeting and the business opportunities to all of you. Thank you. Thank you very much.
Thank you, Mr. Yang. Moving on to the Dubai Healthcare Stakeholders presentation. The first speaker is Dr. Ibtesam AlBastaki. She is the Director of Project Investment from Dubai Health Authority. Please join me to welcome Ms. Dr. Ibtesam AlBastaki.
Thank you very much, and it's an honor to be today with the team from Taiwan. I would like to extend my thanks to FDI and TAITRA for organizing this event. It's my pleasure, and I would like today to speak more about the economy and the situation of the healthcare in Dubai particularly, and what are the opportunities and gaps in the market where you would like to pitch for it in the near future. Who will be pulling the slide for me, please? On the 4th of January 2019, His Highness Sheikh Mohammed bin Rashid Al Maktoum, the Vice President and the Prime Minister of UAE and ruler of Dubai, he basically announced the 50th Charter. And the 50th Charter was having an article, especially article number 5, emphasizing on the healthcare. And he emphasized mainly on the doctor to every citizen. And that's mean that in 2019, there was a lot of appetite in the market to enhance the telehealth and digital healthcare in the market itself. So reaching the services to our people and to our citizen residents and every single individuals in Dubai. So by using that kind of a platform was the initiate idea, and Dubai has worked on it. And plus, on top of this, this issue was before COVID-19, which helped us a lot when the COVID pandemic happened. Let's go to the next slide. We all know that Dubai is a vibrant city and it has a lot of opportunity for the professionals, investors, and entrepreneurs. And we know that Dubai is the hub. It has investor-friendly destination. It's one of the top 10 financial hub. It's the city of 200 nationalities. And we know that the age group of the population, almost like 85% is between age of 15 and 64 years. So here you basically have to think what you need to cater for these age group. And Dubai is considered to be as a gateway, and we all know because it is the hub for the airline industries as well as the aviations, and it has a lot of great work in terms of the logistics. Let's go to the next slide. Now, when you come to Dubai, you will see that there are various health care authorities existing in the market. So therefore, there is Dubai Health Authority, which is my organizations, which cater almost 80% of licensing and regulations. Small part of it run by the Dubai Healthcare City, which is the free zones, and very small part is run by the Ministry of Health. They have few hospitals and clinics in the market of Dubai. And you can see from this slide that since 2010 till 2019, there is a great growth in terms of the hospitals, as well as in terms of licensing the professionals. So therefore, that kind of a growth, it has given a great impact of the sustainability of the healthcare market in Dubai. Let's go to the next slide. So because the health insurance, it's basically mandate in Dubai, this has risen the healthcare expenditures in Dubai by 12%. It's started by 9.9 billion in 2012 and reached to 17.5 billion dirhams in 2017. And we're estimating by end of 2020, it will reach to 24 billion dirhams. And that's because of the mandate, and there is a growth in terms of the healthcare services, and the UAE considered to be as well the top 10 economies with the most efficient healthcare sectors. And if you look at the GDP, you can see that Dubai GDP is about 3.6% comparing to GCC countries. Now, if you look at on the following slide, this is a very important slide which can give you a lot of insight about what is the capacity planning in Dubai. You can see that you have the supply and you have the demand, and there are gaps in terms of number of beds. And these been factors since in 2020, and then we were looking at it or projecting for 2025 as well as 2030. And we can see that specialties with the largest inpatient bed gaps, it's basically you can see in terms of the orthopedics as well as in terms of the obstetrics. And you will see that the gaps by specialty in 2030 orthopedic, rehabilitation, respiratory, obstetric. These are the main one where you can find the gap in the market. Please refer to my slide number 6. I'm in slide number 6. So here you will find that there is a gap in the primary healthcare. There is a gap in the long-term care. There is a gap in the rehabilitation and other services. So the capacity gap is in another critical healthcare infrastructure in Dubai by 2030. Yes, I am on the next slide. And here, I really want to emphasize on the gaps in the outpatients rooms. If you look at the base case in 2020 to 2025, as well as in 2030, anything in reds means that it is oversupply. So please, we are advising you, if you would like to invest, you need to invest in the number which is not in a red color, where you have a gap in it. For instance, as I mentioned earlier, like primary healthcare, orthopedic, respiratory medicine, immunologies, endocrinology, some of the oncologies, as well as trauma and nursing cares and others, which I will explain it more further details on the next slide. Can you go to the next slide, please? Slide number 8. Now I will explain to you in regards to the gaps in inpatient beds. If you are planning to open a daycare services, or you would like to open a hospitals with inpatient beds, you can see that anything in green, that means there is a gap and there is an opportunity for you. You can invest on these specialities. But anything it's in red, that means it is oversupply in the market. So we need to be shifted towards the gaps itself. So whereas the services is lacking. For instance, as I mentioned earlier, respiratory, orthopedic, psychiatry, mental health, all these are the specialties where Dubai is looking for, and there is a gap, and we want to see the know-how, the best practice needs to come to the market. Slide number 9. So health investment, this is a very important slide. Here we'll give you what we really need to invest in 2 to 3 years and what we really need to focus in the 3 to 5 years. Now, if you look at the investment in 2 to 3 years, basically, as I mentioned, innovative primary healthcare. We don't want normal primary healthcare. We need an innovative primary healthcare where you have a multi-speciality, where you have a lot of technologies being taken care. So basically, you can treat and diagnose the patient at that one-stop shop rather than referring to the general hospitals. The other thing we are looking for, like chronic disorder or disease management, we are looking for long-term care, which is a very essential, and there is a really good gap in the market. We are looking for instance, like diagnostics and health remote, for instance. These are the investments or the specialities which require, or which if you really have an interest into it within 2 to 3 years. And in the next 3 to 5 years, where we are looking, for example, into precision medicine, we're looking in terms of the preventive medicine and genetics. We're looking for the nursing and palliative care, for instance. These are the area where we are looking for it in the next 3 to 5 years. Next slide, slide number 10. So if you really want to have an access to these materials, please log into DHA's website and look for Investment Guide 2019. And hopefully we will update it again in 2021. These are the capacity plannings work has been done, as well as the investment work has been done within the market. So if you want to open any clinic, or you are interested to open any facilities, or to gain any license in Dubai, these are the process that you need to obtain. You have to start from the DED, and you have to start then looking into Dubai Municipality, Dubai Health Authority, and so on. Now, One thing I really need to emphasize, it's basically when you start to obtaining for facility especially, we need, I would like to raise some point, something called certificate of needs. The certificate of needs, it's a work has been done by investment department in Dubai. And this basically will approve the facility before obtaining the license. So you need to get an approval before you obtain the license of the facilities. Of course, the obtaining of the license after the certificate of needs, so you have more kind of an advantage in terms of the incentives, in terms of the empowerment in the insurance scheme of the government, and so on. However, the certificate of need, we are aiming to implement it hopefully by first quarter of the next year. And the reason behind that, why we are doing this, we are trying to protect our investors, and as well, we would like to protect the market from the supply and demand. We need to create a kind of a balance between supply and demand in the market. Can we go to the next slide, slide number 11? Which is, I will emphasize here more about PPP models and PPP projects. Now, what is public-private partnerships? A lot of worlds, they have done a massive projects in a healthcare as well as in education and any other infrastructure work between the public and the private sector. And the reason behind this, because we want to emphasize the key components of the PPP models, which is we are looking at the finance point of view. We are trying to distribute the risk between the public and the private sector, and we want to develop a good business case which will be more beneficial and feasible to both the public and the private sector. So PPP model, Dubai is now encountering those PPP model, it's taking it into considerations, and we at the moment are working on a couple of them, which is an interest to so many countries in the world. Next slide, slide number 12. And I am sure you're all aware about PPP models in various countries. UK has adopted PPP model. Canada has done a different model, mainly on infrastructure. Australia, they have done in infrastructure as well as in operation. They handle even the healthcare operations to the private sector. Turkey has done a lot of infrastructure. And UK, of course, as I mentioned, they have done, and South America has done so many of those projects in the world. Let's go slide number 13, where is about the PPP law and PPP guidelines, which being developed by Department of Finance. If you really want to have an access to these material, please log to Department of Finance .gov.ae and access to the PPP law and the guidelines, which is law number 22 of year 2015. So this will allow you to understand and give you a lot of insight in terms of various type of PPP, what is the evaluation and approval of the PPP projects, what are the process in terms of the PPP projects, how does that will link to the government's recruitment and tendering process, as well as it will help you to understand the payment mechanism and risk allocation and how this being transferred between the public and the private sector. So please, if you really want to have an access to the law and the guideline, log in to Department of Finance website and get an access to the law and to the guidelines. So I think I have 2 more slides and I'm going to end my presentation. Please go to slide number 14, where I am basically emphasizing on one of the main DHA's PPP project, which is Cardiology Center of Excellence. This project is almost into the RFQ stage. And now we have almost a good numbers of consortium who are very much interested in this project. And these consortium basically will have an eligibility to go for the next phase or next step, which is the RFP. So cardiology model is basically a PPP model of design, of build, of facility management, as well as it is basically finance the projects while doing the clinical part by the government and non-clinical part by the private sector, and then transfer the building after the 25 years of the contract. My final slide number 15. So we have other opportunities basically looking at it in this coming years in regards to the PPP projects. If you really are interested in our projects, please keep a close eye to our procurement department and our GRP system, where basically you can have an access to the RFP if you are really interested. So there are lots of other projects that we are basically looking at it, like imaging diagnostic. Dialysis and spine is almost done. We are basically launching it by end of the year. Diabetes long term, as well as there are other 2-3 projects in the pipeline. And why we are basically focusing on the PPP projects? Because we're looking for better quality outcome. We're looking for the sustainability. We're basically looking for the improved efficiency, cost reductions, and of course, improve accessibility. And of course, we're looking for the better grow patients volume as well. So thank you very much. And I'll be waiting for your question by the end of this webinar. Thank you.
Thank you, Dr. Ibtesam AlBastaki, for your introduction. For the next speaker, we'd like to invite Mr. Marwan Abdulaziz. He's the Managing Director from Dubai Science Park. Please welcome Mr. Marwan Abdulaziz.
Good morning, everyone, and good afternoon. Firstly, I'd like to thank Dubai FDI for arranging such a webinar, and also the team in Taiwan, TAITRA. And I look forward to interacting with the fellow speakers and the audience. Next slide, please. So Dubai Science Park was established back in 2005 with a vision of creating a community for science companies, companies in the area of all science sectors, including human, energy and environment, and also material. Today we have more than 350 companies with about 3,600 people who work in all of those companies. Next slide. Our aim was to create a dynamic park, a park that will welcome all sizes of companies, whether you are a startup or you are an entrepreneur, you're a scientist with an idea, or a large company who wants to establish doing manufacturing, doing research, launching a product, or even doing calibration, product improvement, or product customization. We wanted to make sure that we have the right infrastructure and the right facilities for you. Next slide. However, Dubai Science Park is not only about facilities and assets, although we have different kinds of facilities, like I mentioned, including laboratories, offices, warehouses, manufacturing facilities. But for us, the supporting ecosystem is as important. Which includes access to students in universities, holding events to talk to regulators and decision makers. And we believe that helping companies to become successful will translate into our own success. Next slide. Next slide, please. During the COVID-19 period, our companies were very, very busy and also engaged with what was happening here in Dubai and the UAE. So we had a few companies that were providing the PCR equipment, for example, Biorad, Thermo Fisher. We had a couple of companies that were running the tests for the testing centers of DHA and Saha. and they were running the the gene sequencing for them. And we also had other companies that were providing sanitizers. So we were extremely engaged with the COVID-19, and when we continue adding support to our community. Next slide. Next slide. So I think what's important to say is that, with the companies that we have, with the assets that we have available, and with the interaction that we have with the outside world, we are at a very unique position to be helping companies that are in the healthcare sector. We can provide guidance, we can provide advice to companies, and we can also go a further step, whether it is to engage with regulators if needed to discuss new guidelines and regulations. Next slide. We are also very big in promoting STEM education in youth. We have a couple of programs that we engage students from the school aged 13 to 15 to basically tell them about what is happening in science, how can science education be important for them, because we believe that nurturing the next generation of students will really be supporting our community. Next slide. We are under we are basically having 3 R&D centers for 3 different companies. The construction already started last year, and it should be ready by the end of next year. And we have been able to really create not only to provide facilities to companies, but also to create unique projects as per the company's needs. So we have, like I mentioned, 3 projects for regional R&D centers for companies, and we have the appetite to customize the facility that is needed for your own needs. Obviously, that goes with a long-term agreement and arrangement, but this is something that we can do, something that we can invest in, and then we have basically a long-term agreement with the company. Next slide. So at the end, this is my last slide. I just want to say that we have been playing a very important role in the ecosystem of Dubai with the healthcare sector. We are active in other sectors as well, but healthcare constitutes about 60% of our companies. It is one of the most important sectors for us. We have really world-class companies that are available in the sector. From around the world, from USA all the way to Japan. And we welcome companies from Taiwan who are in this sector. Even if you are not sure, if you have questions, please do let us know. We should be in a position to help you, or if not, we can at least connect you with someone who can provide an answer. Next slide. I think that, yes, that's it from my side, and I welcome your questions at the end. Thank you.
Thank you, Mr. Abdulaziz. Now we will proceed to another keynote speech session. It's Taiwan's Advanced Medical Technology presentation. We will look into the stem cell regenerative medicine and immune cell therapy. The speaker is Dr. Chao-Sung Chang, Deputy Executive Director from the Committee of Integration and Promotion of Advanced Medicine and Biotechnology from Ida Hospital. Please welcome Dr. Chang.
Our distinguished guests, good morning, Dubai, and good afternoon, Taiwan. It's my pleasure to present you some of
Dr. Chang,
yes.
You're welcome to speak.
Thank you. It's my pleasure to present you some of the clinical cell therapy in cancer treatment and also regeneration medicine. Next. Before that, I would like to give you a brief introduction about our healthcare groups. Actually, under one of the four major sectors under the E-United groups. E-United groups, they have four major business sector. One is manufacturing, especially steel company. Second is for the education. We have one ESO University, which have about 18,000 students there. And third one is the healthcare groups. We have three major hospitals. And fourth one is the real estate and the leisure business. We currently have 3 department store and also Ida World. This is some factors about the healthcare group. We have 3 hospitals. The one hospital is Ida Hospital, about the 1,200 beds. The major provided acute care and the critical care. And the second one is Ida Cancer Hospital, about 500 beds, especially specialists in the cancer treatments. The third one, Ida Dachang Hospital, is provide major smaller hospitals to provide majorities for the gynecologists, obstetrics case, and also pediatrics. Right now, we are going to we can provide about cell therapy and in cancer treatment and some regeneration medicine. Especially today, we are introducing 3 cell therapy products. The first one is autologous control-sized cell seed therapy. This therapy, as we know, as aging societies, a lot of people that have degenerated knee joint. This is the normal knee joints become the degenerated knee joints. Right now, we can have doing the so-called control-sized cell seed regeneration to repair the degenerated knee disc. We have step 1 is a tissue collection, and then collect some of the control-sized and cultures expand to doing some of cell seeds. And finally, put the cell seeds to repair the damaged cartilage. You can see the slides, the PowerPoint. You can see the left upper one is the cell seeds look like and then when we replace in the degenerated the disc, we can see a X-ray to show the in positions. The right hand PowerPoint is the slide is from the degenerated to the after recoveries, the normal recovery to the normal disc. The second one is autologous natural killer cell therapy. This majority provides some of immune cell to enhance immunity for the cancer patients. We normally have some 2 kind of immunity. One is innate immunities, the adaptive immunities. The NK cell belong to innate immunities. We collect the procedures through the expansion and then reinfusion back to the patient. So this steps, 3 major step. First step is to draw the peripheral blood from the patient, about 50 ml, and then we isolate some of the immune cell we call the natural killer cell. That's specific for against the cancer cell, and then expansions in the laboratory for about 2 weeks. And then after that, the safety test, the NK cells reinfusion back to the patients to achieve the enhanced immunity. So finally, is the autologous fibroblast cells therapy. This cells also provide the cell seed techniques and apply to the defective skin. Some of the skin we can using these techniques to transplant this kind of cell seeds to recovers some of defective skin and also increase the skin elasticity. So these major cells we can provide currently, and also since the limited due to the limited skin, this is one of the parts we can provide. Okay, if you are interested, we can. This is a context. Thank you for your attention.
Thank you, Dr. Chang. Thank you. Moving on, we have Dr. Douglas Huang, founder and president from EPED Inc., to introduce their stereotactic surgery navigation system. Please welcome Dr. Huang.
Distinguished guests, ladies and gentlemen, good morning. I'm currently in charge of this company, the EPED Inc., which is especially for the precision medicine. Here, the company basically is for stereotactic surgery navigation system, which we will providing for the minimally invasive surgeries. Our company established about 12 years ago, and we start from the optical positional technology, and then we're uploading our value of safety, precision, efficiency, and minimally invasive. The company already 12 years, which is basically control all the equipment, the technology, and also providing the service to the hospital and also for the school, medical school, for the training system. Here is our core technology, which we can supply, is optical space location technology, which we use the camera to control and the infrared to control the point in the space. And then we have a very strong medical imaging software team, which we can supply for any desire, and also any the hospital that you need to providing the special the functions. And also we are providing the educational knowledge, which including medical and dental for training the student and also training the doctors that before you are going to meet your further surgery or technology or even the technical. And finally is individualized. We can individualize them, which you can providing any requirement from even the school, the hospital, or any doctor during their treatment or their surgery or their any kind of case. Here I recommend our system, which is the stereotactic surgery navigation system, which is basically is for the minimally invasive. The surgery which we need is precise and also the accuracy, also the fast. So we can shorten the registration time that less than 1 minute. So this is our technology and is our core technology to providing the doctor can save their time to finish one complete surgery. And also we can providing any our system combined with any kind of brand, any kind of instruments, which we can combine with this system to match your surgery. Basically, there are three parts. One is the optical tracking system. You can see this, and then we can providing the imaging system. We can fusion the CT, MRI, or any other imagings. And then we can providing the instruments which we can customize the system that including no matter from your microscope, your endoscope, or even your surgical instruments, we can always combine together and also link to the system that no matter from other system, including the different system from other different surgical appliance. The retina, this navigation system, basically we can supply to any kind of surgery, but we concentrate on the neurosurgery, on the ENT, craniofacial, the plastic surgery, and also the oral surgery. And in any place that you want to do the surgery, we can supply you for what you need. We just need the case, and then we can do the report for you. Even you need some report for technical report, we can supply you the basic, including optical, also some important cases you want to report. We can give you some of the insight of the technology data. The key function in our the system, we have the nerve indication, for example, for facial nerve, for trigeminal nerve, or any other nerves you want. We can immediately to show the nerve, and then we can do the segmentation, which you can decide it or planning your surgery, the route before you do the surgery, and also you can drawing the tumors or any lesion you want to mark on your surgery. While your surgery can do the finding the system immediately, and then we can supply you the mirror system, the mirror function, which you can do especially for the plastic, you can immediately to mirror the other side to make sure your surgery can complete. So here I show you some of the cases that we have done. We have done more than 100 cases, hundreds cases. Here is the occipital tumor, which we can from the back of the head, which is most difficult part that we can easily to register it, the system with your image together immediately within 1 minute. And then you can see some from the ENT cases, which you can do the sinus tumor, or even for neurosurgery, you can also do some like pituitary gland tumors. So it's easy to go through your nose. So you can go through your nose to zygomatic to go inside and to do the surgery through the navigation system. Or you can do some plastic surgery, which is, for example, like here, you can do the right orbital bone that you have fractured, then you can do direct from the eyelid. So you can do the minimally invasive, so you can complete the surgery. And also you can do some oral surgery for tumors, or even in the near future, we can providing like OGS for the craniofacial level 1 or 2 surgeries. And then this is what I report. And you have any question or you want to contact us, here's the information that in our the office. Thank you.
Thank you. Thank you, Dr. Huang. The next speaker is Dr. Brian Lin. He is the General Manager at Cloudmed Co Limited. He will share with us personal healthcare solutions among COVID-19 period. Let's now hand the floor to Dr. Lin.
Thank you. Good afternoon, everyone. Today we want to share some experience when we setting our product and promote our product during the past 2 years. So actually our product is a very personal healthcare system. This is the world tiniest, only 16 gram, and you can monitor a very key index for SpO2 to against COVID-19. Okay. Actually, we have a very good, successful proven record. We selling over 8 countries. It's all data. Now we new added is United States and Canada. Now we are the best seller in Taiwan. We selling over 10,000 tiny system in the past 2 years. So actually, this is something. No, I mean. Okay. So our company is transform the traditional and the general treatment from the digital and personal treatment. Okay. But you can control the slides. Oh, next one. Next one. Okay, so how to become health is very important. Firstly, you have to measure your body status. So our device, we will let you to measure yourself. And then we use our cloud algorithm to analyze your status. Then we give you the actions. So if you can follow our actions, you will get the behavior changed. Then you will become health. So this is our health loop to let you become health. So next one. So it's our advantage. When we promote our device, I think easy to use is the first key part. Because if your device is very difficult to use, the user is become very hard to accept this new device. So the first one is easy to use. The second one is affordable. It's very cheap, only 99 United States. This is a table. US dollars. And then it's portable. You can put anywhere, especially in your pocket. And then it's trusted. You can get money refund within 14 days. The most important, we provide multiple login, so you can share with your doctor and your family can log in with the same cloud. So next one. So you can get, actually you can get a very important 15 key index, including blood pressure trend, ECG, SpO2, and more. And you can give different 3 report, advanced report, and weekly report, and the instant report. And you also can get a consultation on the app. So next one. So one device can for one family, and we provide a multiple login. Next one. So we also provide a medication reminder and the instant report. Next one. And also the waveform update. So you can store every measurement in the cloud. So next one. And we also provide the food suggestions according to your test results. If you are very tired, we will provide you more highly nutrition food in your app. So next one. And this is a real report. When you measure one time, it takes about 6 seconds, and you get very detailed ECG report and also irregular heartbeat and anything about your heart health. So next one. And also provide expert consultation online. Next one. So this is a blood pressure trend. We measure the PWTT from your heart to your fingers. So this time is inverse proportional to your blood pressure. Next one. And this is SpO2 for COVID-19. Is we know if you get very severe COVID-19, your SpO2 will down to below 95%. So next one. And we also provide a fatigue and pressure index is measuring from the HRV, so you can deal with your emotional problem during the work. So next one. And this is PPG and the body age. We measuring the time and 2 peaks from the PPG, so you can measure your body age. So this is very general in the hospital examinations. So you can maybe in the past days you have spent a lot of money, but now you just need our device and you can get more results here. So next one. Next one. Next one. Thanks. Next one. So this is a real benefit is what we want to share today. When you measure very long time, we will give you very useful big data like the right part will point out some suspicious congenital heart disease. This is very important big data, especially for healthcare and the long-term care. So the left side is the well-controlled blood pressure. So the daily measurement and every time viewer is very important for healthcare. So next one. So this is our customer. They measure the ECG and found some problem. In the past, you have to go to the hospital now, but now if you have eye care, we can already detect on your heart disease. So next one. And this is a irregular heartbeat. We use a lot of AI-based technology to put on the algorithm on the cloud. So we will automatically generate this kind of results and save the time and save the money before coming to the hospital. So next one. And this is a very important. This is our key customer. They use our IK device for 1 year, and he changes his behavior. So his blood pressure is down to 5.3% and 4.2%, and his heart rate is going down to 12.2%. It's very important. When you use eye care, we give some actions. If you follow this, you can become more healthier. So next one. So it's our promotion related stuff. So next one. This is a key summary. If you are interested, you can see this one. So the next one. Yeah, we have the commercial office in the United States and R&D center in Hsinchu and the manufacturing company in Tainan Science Park. Thank you. This is my presentation today.
Thank you, Dr. Lin. Thank you. The next speaker is Dr. Ing-Hsien. He's the medical officer from Soteria Biotech company. He will be presenting to us about the forerunner in sleep technology. Let's hand the floor to Dr. Ing-Hsien.
Hi. Hello. Good morning over in Dubai and good afternoon over here in Taipei. Thank you for having me here. My name is Ing-Hsien. I'm the medical officer for Soteria Biotech. And thank you for giving me this opportunity to let you know, to show you that what we have achieved. Next, please. Okay, so our goal, what is our goal? Our goal is try to achieve the following by using our developed technologies. One is to have a health risk evaluation, then a chronic debilitating disease prevention, to increase nation's productivity, and to decrease nation's health-related spending. And our product can be applied to sleep medicine, to insurance, to smart city, and to elderly care. Next, please. Look at this chart. This is actually a study done in Dubai a few years back. This is basically the evaluation of the risk of the obstructive sleep apnea over in Dubai and UAE. Looking at the chart, where the blue part is the male population and the red part is the female population. And as you look at that, and then they were subdivided into different groups. If you look at into that, as people getting older, the risk of getting obstructive sleep apnea is higher. Next, please. So what's about the obstructive sleep apnea? Itself is not really a threat to anybody, but it is associated with many important and severe conditions, including metabolic diseases, high blood pressure, high blood sugar, atherosclerosis, heart attack, and stroke. And there's some study, especially in the US journals, that they show that the OSA patients are having higher risk of what I just mentioned previously. Next, please. So there are also many other studies show the similar trend as the chart that I showed earlier, that the geriatric population are more prone to OSA, obstructive sleep apnea. And what's even worse is that it has been shown that the OSA may even increase the risk, especially for geriatric patients, risk of Alzheimer's disease. Next, please. Children are also prone to OSA too. In the study the American Sleep Apnea Association suggests that as many as a quarter of children diagnosed with ADHD actually have symptoms of obstructive sleep apnea, and their learning difficulties and behavioral problems can be the consequence of the chronic fragmented sleep. Next, please. So in the current diagnostic procedure for OSA is polysomnography, PSG, commonly known as a sleep study. It takes about 6 to 8 hours overnight. So the patient has to go to the sleep center to sleep overnight. And looking at the picture, that the patient is actually having a lot of wires and sensors. So we know that this is actually a very difficult task for both the technician and also the patient. Next, please. So our solution is actually our software. Our software is called Soteria 1.0. It is a CE marked class 2A software medical device. What it does is it analyzes patients' head and neck medical images and provides information. The information basically is the airflow pressure and flow velocity within the airway. And those information can be used to assist in the diagnosis and the treatment plan of the obstructive sleep apnea. The procedure for the patient is actually very simple. All patient needs to do is go to take the head and neck medical image, and the rest are done in the background. So afterwards, the report will be sent back to the doctor, and then patient just needs to go to doctor to confirm the diagnosis. Next, please. So our competitive edge for this and with PSG or the sleep study or the home sleep test is that the operation time for us, we can do this in the during the daytime instead of sleep overnight, and it only takes about 30 minutes to complete the test. And then it can also be used for both adults and children. And then so especially in this COVID time, we know we try to spend as little time as possible in the hospital to reduce the chance of infection. Next. So that's all for my presentation. Thank you very much.
Thank you, Dr. Ing-Hsien. Last but not least, we have a speaker from LIGHTMED Dental Company, Mr. Eric Lim. He's the business development director to share with us ERIAG laser versus traditional approach clinical studies. Now, please welcome Mr. Lim.
Thank you, Madam. Good morning to Dubai and also good afternoon to Taiwan. Today, I would like the pleasure and honor to the LIGHTMED to present how the LIGHTMED, how the LIGHTMED company, the background, also how do we provide the product to provide such the solution to all the help to the people. First of all, I would like to introduce the background of LIGHTMED. LIGHTMED, we are developing the laser, especially the medical laser. Now we have our facility based on in United States and Taiwan, Japan as well. Based on our group, we have provide for such the different medical laser, especially in the ophthalmic. We provide for all the solution for eye disease, and also we have developed in the dental laser, and also we can provide social dentists to recover or continue on the daily operation. And now this all very welcome, the more popular in the cosmetic is another sector. We developing the dental laser as well. So later on, let me introduce for all the LIGHTMED history. First of all, we from the 1991, we have the facility built up in the United States and also Taiwan that in the production basis. And you see that the first one we are developing the first the YAG laser in Taiwan and get the FDA and also CE approval. In the 1987 and 1988, we started to give it give you build up the global channel to sales order global marketing. And also we are all the OEM partner for the Luminous is the most the biggest the laser the equipment supplier. For the 2000 we have developing our own technology to provide retinal the laser green laser, and also in 2009 this is the first one we built up the SOT which is we solve the people suffering in the glaucoma. And also he's the first one that we built out the dual wavelengths that laser in one unit. And become true 2015 and also 2015 we built up our facility production basis in United States and also Japan, and also we are another new company in the South Asia, the Science Park in Taiwan. We have we built the first one, the dental laser. This is our R&D trend for the LIGHTMED. And right now we are present currently urban yak water laser. In here I would like to also present you and know how we can solve and also to help people. They are suffering in all the disease. Urban yak laser is the most first one. The laser they can cover the traditional scalpel and also hydrio and also electronic knife, and also provide for the dentist. They can solve the minimum invasive and provide such comfortable experience for the patient. So now this is the most in the modern way, and how we can support and help the dentists for their daily operation. Ourselves, so this system we built up the 20 preset parameter to help the doctor performing the hard tissue and soft tissue, and give you the more the patient more comfortable, and also give you the doctor more efficient way how to know the side effect after after the surgery. I'm sorry this about all the going on the field, maybe the field broadly, but this is real. Currently now the dentist, what are you doing in your oral while they are operating? You can see the different compared to the traditional wet scalpel, and left side is our LIGHTMED sapphire laser. And so you can see the traditional when the dentist use the scalpel open the flap on your old, and they have to sew after the surgery. But if doctor use our anti-yak laser, urban yak laser, they are completely very clean, and also while they surgery, they are kill the bacteria in the same time, which means it's another effect and provides the patient more shorter the period for the shorter the recovery period. Next one I will show you. Share with you about the period in implants. Right now it's more the people that they are doing the implant. However, if the patient did not take care of the teeth very carefully in daily, it's very easy to getting on the bacterial infect, and then got it in the period. So in the period is very headache for the old dentists, because they have to open the flap and using the traditional like a diamond burn and also scalpel, and to cleaning all the tissue or all the infection the tissue on the teeth. Right now you can see in the traditional way when the doctor opened the flap, and then they are using the high-speed drill and also using the diamond burn to clean all the tissue on the flap. So, but this kind of the treatment, it will give you the patient maybe take longer, like 2 or 3 weeks to recover the period. But when you use it out the water laser, it's quite maybe easy to clean all the tissue and also clean the bacteria in the infection area, and then it give you the patient more comfortable, and you get comfortable and experience, and then shorter the recovery period. How do we can make it successful to developing the Middle East the marketing? Like we are over here discussing how do we can successful developing our business in Dubai. Especially a very important key is you have to make your company become to globalize. What's the meaning globalize? Based on the first one, you have maybe the good IT instruction. Like right now, we are here holding the webinar, and also the most company you can show you now we have Facebook and using your website do the promoting your product. Now the more getting the more efficiency way, and like we are here holding a webinar. So you can see the right hand now the LIGHTMED invites such many good medical doctor share the clinical cases on the webinar. Right now we have holding the all maybe the many time in the webinar to share all the doctor in the clinical cases, no matter why in the ophthalmic, dentist and the dermatology as well. So secondly, you have to get your company more globalized. Like the LIGHTMED, we are become true holding our core technology in laser. So all the parts we are getting more modularized. So that's why we can build up our facility, all the technology in the different location, the country diseases. Like right now, just I present you in the United States, Taiwan, and Japan as well. So it's very easy. Later we build up our business and also our facility in the global. Next one is a more message I will share all right here about the COVID-19. For all the clinical paper we show up, the problem currently now the spreading pandemic COVID-19 is due to the coughing, sneezing, also especially happening in the dental care. So you can see in the most long distant way, this aerosol will spreading longer like 6 meters. So that's why right now it's more dangerous and risk for the dentist if they are doing the daily health care, dental care. So in the paper we show up right now this is improving by the CDC in the United States. When the dentist is using the laser, especially water laser, it will reduce the spreading, reduce aerosol, and stopping the spreading the COVID-19 issue. Right now, they show you comparison the different. Right side is the traditional way. When the dentist is using the high-speed drill, you can see the aerosol and the droplet spreading in the air. It brings on the more risky by the dentist, nurse, and also the patient as well. But the right side is our machine is using our urban Young laser. Later on, I will maybe show you the one field how to compare the different. Please. You can see while the doctor using the traditional way, you can see all the aerosol and the lip drop always spreading in the air is bringing so high risk for the dentist infection by the virus and the bacteria. But the right hand side is our urban Young laser. It's no clean, no aerosol, and also very good way to raise the infection, the virus. So this is quite we are now the older present and give you the more message. It's quite an efficient and safe way using the laser equipment. Okay, that's all my presentation and with the series with you. Thank you.
Thank you, Mr. Lin, for the introduction. Ladies and gentlemen, moving on to the questions and answers session, I would like to introduce the moderator at this part. Our moderator is Mr. Woody Wang. He is the director at Taiwan Trade Center in Dubai. We are honored to have him with us here today. Please join me welcoming Mr. Woody Wang.
Okay, good morning everyone in Taiwan. Good afternoon. So this is Woody from Taiwan Trade Center, Dubai. I'm the director of this office, and also we are happy to have the chance to organize this event together with Dubai FDI. After this nice presentation from the Dubai and Taiwan side, I think both us we have a lot of expectation from both sides. So now it's the time we can go through the question and answer. First, we have some question from the Taiwan side. We hope we can get some good response from either Dubai FDI or the DHA of Dubai or in the Science Park. So let's go to the question one. It's from the Taiwan LIGHTMED Dental Company. First question is how to simplify the authentication procedure in Dubai. I think this means there's some medical item and related item. If they want to get into the market in the Dubai, suppose there was a lot of procedure to get the authentication like this. For most of the Taiwan company, they asked this kind of question before. So maybe they're still not clearly for this kind of procedure to get the authentication in the right way or in the faster way. That's the reason they have. So please, from the Dubai, most of the street doctor can give us some suggestion or idea. Thank you.
I can answer that question. It depends on the product. I mean, if it is a medical device or medical equipment, then there are separate regulations under the Ministry of Health. The registration of any product, whether it is pharmaceutical, medical device, medical equipment, is done at the federal level, which is the UAE Ministry of Health. And they have different requirements. For example, medical device, you need the CE mark, you need other requirements that is available on their website. And once you have that approval, then you can access the UAE market. And also going into other GCC markets, it will be easier once you have the UAE market, the UAE approval.
Yeah, okay. That's a good answer for us. Besides Dubai, also there's a good chance they can explore to the GCC market by this way.
Yes, yes.
Thank you. Thank you. For the second question, from the EPED Incorporation Taiwan. Question is, what is the growth expectation of minimally invasive surgery device within the next 5 or to 10 years in Dubai?
I think this one, Dr. Ibtesam can take it. She touched upon it a little bit in her presentation, but she should be able to give more input about this. But minimal invasive surgeries, there are so many types. But maybe, Doctora, you can elaborate from your end.
Sure. Basically, first of all, thank you very much. It was a very much interesting webinar, but I would say that please refer to the investment guide, which I touched a point earlier in regards to the outpatient and inpatients. Maybe there was some lag in terms of shifting the slide. Maybe you have missed it, but if you go to DHA's website, just search for Investment Guide 2019. You will see the capacity planning in terms of specialities and in terms of inpatient and outpatient services. And you will see that there are some services oversupply, like general surgery, but there are some specialities is under supply when it comes to some specialities. So please refer to the Investment Guide 2019 at the DHA's website.
Okay, so that's a quite good answer for this question. Mainly is from the DHA website. We can get this more detail of this kind of information. Thank you. Thank you for the Dr. Ibtesam. Now we go to the question 3. Today, how many dental schools have already adapted the computerized evaluation system in Dubai?
What do you mean by that evaluation system?
Computerized evaluation.
Oh, computerized.
Yes.
I think most of them have computerized systems. I know, Doctora, you're muted.
Doctora, you're muted.
Sorry. It's most of our services, you mean within the DHA, Dubai Health Authority, is digitalized. We use EMR system, electronic medical records by EPED company. And now we are going to the next step, which is the integrations between the public hospitals and clinics and the private hospitals and clinics. We started just as a phase 1 last week with one hospital. Now slowly we will try to expand it to the rest of the private providers within Emirate of Dubai. And this program, we call it NABUT, which is an integration system between public and private. Now, most of our services are digitalized. Even if you are requiring for any licensing, for any facilities, for professionals, you need to go through DHA's website and you will basically need to register, and according to the guidelines, you will ask for the next step and for the whole process. Just to emphasize on one thing, that anything to do with pharmaceutical manufacturers, anything to do with equipment, you need to refer to the Ministry of Health, which is the federal government, which look after the whole UAE. But anything to do with pharma retails, then you need to basically register through the DHA's registrations from licensing perspective, or through DHCC, which is the free zone area. So I hope this is clear.
Yes, it's very clear. From the question I found, this means dental school. So I don't know. I think we have to get some clarified from the Dr. Douglas Huang. This means for school certificate or testing like this, or for the dental clinic. Maybe Dr. Huang is there. Would you please have some explanation?
Hello? Yes.
You mean licensing?
It's about dental school, because basically
dental school.
Yeah, dental school for a dental student. You can
yes,
evaluation their technology. I mean, usually it's not by the teachers or the human eyes. Usually you have to use the computer to evaluate their technology. So the system, which is popular in Dubai, because we have some customer there, but I want to know, is this popular in UAE or Dubai?
Yes, we do have a dental school. It's called Hamdan bin Rashid Dental School, which is located in Dubai Healthcare City. And they have a lot of simulations over there. It's a very high tech, and it is linked with the Mohammed bin Rashid University as well. So it's basically there. If you have more informations or you would like to gain more informations about it, maybe we could help you and to link you with the dental school over there.
Okay, thank you very much. Thank you.
Okay, thank you, Dr. Ibtesam. Now the question 4, I think it's good, very right target to today's topic. Question from Taiwan main orthopedic biotechnology company. The question is how to process a French company in Dubai, and is there any solution with government support or investment? Because they have hospital customers and they would like to have a branch to do after service and looking for investment also in Dubai.
We can help with that. We can help with the support, to set up a branch of a company. We, like I mentioned in my presentation, we have more than 350 companies of all sizes, small and large. So we can provide support in that. And when it comes to hospitals and investors, it really depends on the product and how the approach is to the doctor. A lot of times you need to speak to key opinion leaders for you to get input about your product. And if the doctors like it, then they can recommend it to the healthcare system. And then it's reimbursed, but you really need to start that engagement. If you believe you have a good product, then Dubai and also the rest of the GCC is a large market, and we are a test bed for a lot of new innovative products and solutions. So it's it's wise to start from here with a small start. We can support with a very economical startup package and support the company, and then you can just grow your business as you grow.
Okay, that's quite good suggestion. So mainly Dubai FDI is the contact window for any kind of investment, right?
Yes.
We are always in the support to assist and give the guidance for the investors, and of course providing with the advices of where and how to set up the company in Dubai. As Mr. Marwan mentioned, Dubai Science Park is one of the place where the investor can start his office to set up his office, either as a fully new office or a branch office, as being asked on the question.
Yeah, okay. So if any investor, suppose we will recommend the contact with FDI or any question before FDI, also welcome to check with our Taiwan Trade Center Dubai office. Thank you. For the last question, what is your suggestion for a medical device startup company want to do business in Dubai or now?
I think I answered that previously. We have packages that are for small companies and startups, which is very economical, coming to about $10,000 a year, and that is tailor-made for startups. It really depends. I mean, it's a very generic question, so I cannot say. It really depends on the product and what kind of a product it is. There is a lot happening in the device sector, whether it is for surgery, whether it is for dental, whether it's for orthopedic. There is a lot happening, and it's an exciting sector as well. I think more than the pharmaceutical. So I have just dropped in my email address. So if you have further questions, please write us, and we'll come back to you. And we'll be more than happy to connect you with people who might be able to give you some ground support.
Okay, thank you. Really appreciate. For the question we have has gone. So from the site now, if there's any question from our audience or from Dubai, any officer, we are also welcome. We can have time for 2 questions remain. Thank you.
Yes, we have one question on site.
Yeah, please.
我邀请阿拉伯国家参加全球1000万医师的培养计划。2000年，我不讲英文。2000年，我参加行政院第5次科技会议，提出生长基因在20到50岁中间可以永生。2012年，专家提出基因编辑。2014年，我再提出细胞疗法。2015年，卡特总统癌症扩散到脑部治愈。2017年，细胞疗法引进台湾。2018年，台湾通过细胞疗法法案。那我现在是要投资6万3千兆美金的虚拟货币银行，分行设立在杜拜，由王储担任杜拜的负责人，负责中东地区。请问你们有什么看法？谢谢。
This gentleman, our guest, he has a huge investment plan. First of all, he hope we can invite most of the doctor in UAE to join his plan. The name of the plan I will clarify with him later on. It's join the Doctors Union. The target around more than 10 million doctors unions, and to do the research and the project for the gaining project in the medical field. And he will try to set up the virtual bank in UAE. Try to also invite the Sheikh to join for this kind of the project. I think it's a good idea, but for more detail, we have to check with him. He hope from your side, someone will be interested to join this kind of the project. This is the question from the gentleman.
I think
it will be good if we
after the webinar we'll have a one-on-one discussion, and we need to look at the details. From what I heard was something to do with genetics and maybe sequencing. So sure, why not?
Okay, thank you. 那刚刚这位先生您贵姓？不好意思。
他姓梁。
梁先生是。那这个计划蛮庞大的，所以就是会后再跟您讨论细节上大概怎么来进行跟处理，比较能够促成，好不好？那他们基本上听到这个计划很高兴了，当然非常欢迎促成。那但是这个计划庞大，所以细节必须要再多了解一点，怎么来进行比较有可能把它实现的。Okay. For the last question from anyone who are interested, please welcome now.
请问现场还有听众想要提问吗？那5位讲师。
I have a question. I like to know. Maybe you don't have the answer, but I would like to know because recently the Israel and the UAE, the relationship is warm up. So is any medical equipment, any medical device, or any medical drugs, anything, pharmaceuticals will import from Israel?
I can answer that question.
Okay, go ahead.
Sorry, Waleed. Go ahead.
No, that's okay. No, that's okay. Go ahead, Marwan.
We have already, in fact, today I'm meeting an Israeli group for lunch. So I can tell you that our relationship and dialogue have already started. And there was a law that was issued, I think, 10 days ago, allowing the UAE to import and use Israeli products, which was boycotted in the past. So to answer your question, yes, the relations are open. There is direct flights to Tel Aviv. The Israelis are coming. I've met a couple of them already. And we are very excited about this opportunity because, as you know, Israel is really very well known for their R&D and their innovation. So we are working with them to establish what kind of collaboration we can do, how can we import the innovations that they have, and how can we also support them to go to the world from Dubai. And this is really what we're working on. So a lot happening between the UAE and Israel in these weeks.
Yeah, okay. Sorry, please.
Yes. The Israel medical products will export to UAE recently. Is that right?
The Israel minister?
Medical equipment or medical device, they will import. Yes. They will export to UAE. Okay, thank you.
Yeah.
Yeah, because the relationship between UAE, Israel, and some GCC countries are improving now day by day. So we hope the business between these two countries is getting more in the near future soon. Also, if you are here in Dubai, try to explore to Israel, now become possible. It's also a good news for the investor or businessman come to Dubai.
And I think Walid will arrange a trip for us to visit Tel Aviv soon.
Oh, okay. Yes, that's great.
Thank you, everyone.
See you by next year, Marwan.
Sure.
Thank you, everyone. Finally, we are honored to have Mr. Wang to provide us with closing remarks for this successful webinar. Mr. Wang, please.
Okay, thank you. Today we are happy can have this great chance to have cooperation with FDI, Dubai Science Park, and the Dubai DHA, and from also the excellent Taiwan companies who did a nice presentation to let you know all this kind of the excellent technology and medical related items from Taiwan. Now it's during the pandemic situation. Even the business limited, but we try to do all the promotions through the online like this webinar. And we know the Taiwan is a good model of the example for the anti-COVID-19. So far, we have only around 500 cases in the Taiwan, around the Taiwan country. So we try to do best to help other people to have a good way how to fight with the COVID-19. So Taiwan has set up by TAITRA, there's a COVID-19 pavilion. We will share the world experience and solution for fighting COVID-19. Also, we connect the world demand for everything from the COVID-19 Taiwan solution provider. Through our website, you can access 20 Taiwan medical institutions and 2,000 plus Taiwan companies to help you fight the COVID-19. Also, you can see the story and the insights shared by experts from the various fields in the fight against COVID-19. We also tell you about the major approach used by Taiwan to effectively control and stop the virus from spreading. And also, no matter where you are, we can offer you the rapid online assistance to arrange online medical conference, online procurement meeting, and even online sourcing service. So far, our website has been visited more than 60,000 users from either the Europe, USA, and most of the Asia countries. The pavilion can be accessed online at the anticovid19.tw. We are welcome you visit our website anytime. And besides Taiwan, Dubai side also is a good leader, especially in the GCC country. They did a lot of the COVID-19 testing, and the testing case is the first country in the world over the population of the country. Also for the vaccine, they are also the leading way because most of the medical first line people already they can get the vaccine for this COVID-19. And the business situation here is still remain open. So we can also learn from Dubai government how to fight with COVID-19 together and do their business remain in the good situation. A lot of the things we can learn from them. So under this situation, Dubai is still open and welcome the warm welcome to let most of the foreign investor and businessmen to come anytime. And today is a good chance we have idea now about the Dubai investment climate and the business market related especially for the medical items. So we hope most of the Taiwan company and try your best either after the situation getting better or before that we can through any online or webinar or email to contact us or Dubai FDI. We will try our best to do our support. Thank you for participating today.
Thank you, Director Wang. Ladies and gentlemen, this concludes the webinar today. Thank you for joining in. We hope through today's event, you would have a better understanding of the Dubai healthcare market and opportunities. Thank you again for joining, and we wish you every success in your future endeavors.
Thank you.
Thank you very much.
Thank you very much. Thank you for everyone.
Mm-hmm.
Thank you.